All right, well, we'll go ahead and get started this morning. Welcome. I've unmuted Barry Dunaway, President of Leadership Akron, and Chris Williams, Senior Director of Leadership Development for Heart to Heart Communications, who are going to get us started here this morning. Welcome, everyone.
Great.
Thanks, Jeremy, and welcome. This is our fourth Leadership Connection series, and we're so glad to see everybody. It's fun to see everybody as we get online. And as Barry said, it's a form of Hollywood Squares, but it's a way to connect. So just as a reminder, whether this is your first time on or your fourth time on, that the intent of these leadership series is, quite frankly, to bring us together and to share ways to leverage our strengths as leaders and as organizations for the community, and to creatively do that. And we have so many people have shared creative ways that they're working together right now. So the second reason for us getting together is just to help us reflect on our own leadership perspectives. And depending on the topic, whether it's been hope or compassion or persistence, or this week it's on collaboration, it's really just a pause point to say, let me look within and at myself and that quality within myself and how I demonstrate that with others. And the third intent is just to share some resources with you, or you may want to share those with your staff, so we have those online as well. And just again, as a reminder, we'll go from 11 to 11:30 today, and then we have an optional session from 11:30 to 11:45 where we gather together in discussion groups to just further talk about what we heard today from our speaker. So at this time, I'm going to turn it over to Barry, who will introduce our featured speaker today.
Great. Thank you, Chris, and good morning, everyone. We are incredibly honored to have Lisa Aurilio with us this morning. Lisa is the Chief Operating Officer at Akron Children's Hospital. In addition to her role as COO, Lisa is the Incident Commander at Children's for HICS, which is the Health Incident Command System, which was put in place after 9/11 to coordinate health efforts at times of crisis. And in that role, Lisa works hand in hand and collaboratively with other leaders from other healthcare institutions across our region and in Northeast Ohio and even beyond to the state. And just to give you one example of the collaboration that's taking place that Lisa shared with me is under the current environment, Akron Children's is prepared to take patients up to the age of 36 as a way to provide relief to their adult hospitals in the area. So that's, I'm sure, just one of many examples that Lisa can share with us today about the collaboration that's taking place, and thanks to the leaders who are coming together to serve our community. So I can think of no better leader than to have Lisa with us to talk about collaboration. So Lisa, I'm going to hand it over to you. Also want to remind everyone who's with us, we know many of you will have questions for Lisa, and we invite you to ask those questions through the chat feature between Chris and myself and Jeremy and Susan. John will keep an eye on those, and we're happy to tee those up for Lisa when we get to that time. So we would welcome your input. So Lisa, I'll hand it over to you again. Thanks so much for being with us.
Thanks so much, Barry, and thank you all for inviting me to talk about collaborative leadership today. Before I start, I really do want to give a shout out to my colleague, Dr. Rob McGregor, who's a Leadership Akron Class 32 graduate alum. He is my co-commander in the Incident Command System, and couldn't be leading with a better colleague. So I wanted to thank him for his support too. So as I thought about collaboration, you know, it made me really just think back a little bit about what I've learned about Akron through my Leadership Akron experiences, as well as being in the community for the last 17 years. And it really struck me that the culture of collaboration that we have in Akron and in our community has really never served our community better than during this time of the coronavirus pandemic. I've really seen so many sectors of our community that have really come together to reduce the spread, support our local hospitals, making sure we have the right personal protective, or otherwise known as PPE equipment, and preparing for a large number of patients that could come to our local hospitals. The Institute of Collaborative Leadership Hank Rubin really defines collaborative leadership as purposeful relationships in which all parties strategically choose to cooperate in order to accomplish a shared goal. So in other words, a community agrees to shared outcomes, and then individually they return to their own homes, environments, organizations, and figure out how individually or as an organization they can really meet that shared goal. And we all become collaborative leaders when we accept the responsibility for building and helping to ensure the success of individuals or teams to accomplish that shared purpose. And collaborative leaders really demonstrate a lot of characteristics. A few key things that I think all collaborative leaders really strive for are: one, our objectives are to deliver across boundaries and between differing organizations. Two, really gaining value from the differences and the diversity of the groups that are coming together. And really sharing control and trust in our partners, and believing that when our partner leaves us, they're going to fulfill and execute to get the outcome that we want. They may not do it the way I would do it or our organization would do it, but they're going to do it in their own way to still move towards that common purpose. And I think that those are really the key objectives that we have to accept and embrace as we move towards collaborative leadership. There are a lot of traits and characteristics around collaborative leadership, but a few that I've seen really that come to float to the top in all of the pandemic that we're experiencing, that I thought I would just call out some that I've seen done well at both the state, regional, and even within my own hospital organization, that I think are so vital to collaborative leadership. So the first really key, I think, is setting a clear objective and goal for the team, and really getting everyone to galvanize around that goal and vision. And I think we saw that at the state level when we hear and listen to Governor DeWine. If you listen to any of his press conferences daily, really the first thing he started talking about was flatten the curve. I don't think any of us had really heard that term or really thought much about what that meant until he started talking about it every day with Dr. Acton. Flatten the curve, that's our goal. And it really did start to galvanize our state around what we were trying to do. At the hospitals, we were talking to our staff about flattening the curve, but we were talking to them about two other important goals. One was conserving PPE. So we started talking early on about how we're not going to waste masks, how we're going to use and recycle gowns, how we were going to do things differently around the use of protective equipment. And our second goal at the hospital that we talked a lot about across all the hospitals was, how are we going to prepare for increased numbers of patients? How are we going to need to do things different to make sure that we can support our community in their time of need? So being really crystal clear on those goals is one of the most vital part of collaborative leadership. I think the second really important goal is really building that trust with your team through communication. Being transparent, factual, responsive, and understanding that your team is sometimes going to be coming from a place of fear, especially around this pandemic time. And so how do you build that message to your team and share that message with as much detail and as much frequency and as many visuals as you can, and making sure that there's opportunity for two-way communication. So ways that I've seen that play out in the last few weeks, if we talk about it at the state level, you see Governor DeWine and Dr. Acton doing daily press conferences. They started early in this conversation. They've been consistent. People know 2 o'clock, you're there with DeWine. They brought out the charts and graphs to show the visuals of flattening the curves. They have hotline numbers set up. And they really did a nice job on foreshadowing the message on where we were moving in the shutdown. So early on, they would talk about early childhood daycare centers. And they talked about that 3 or 4 days before they moved to the place of closing the childhood daycare centers. Same with the stay-at-home order. They built that message. On the hospital side, we did the same thing. We at Akron Children's created a way that we would have predictable and reliable communication to our staff. So we did that by having one daily email that came out specific with key takeaway messages of the day, important messages on changes our staff needs to know every day. And the other thing we did was to establish a daily leadership video. So every single day, weekends included, our leadership team, our president and CEO, Graceful Kulchik, the incident command team, gives a briefing to our staff. And we provide opportunities for them to call in to our employee health if they have their own health concerns. We've gotten over 1,000 of our calls into that center so far since we've opened it. We have an opportunity for them to email questions. We've gotten 120 questions that people get personal responses back to. So really just using those communications, being out front and giving people that sense of trust in that they're getting the facts they need. That really helps alleviate the fear and makes them, again, want to focus on how can they help to advance that goal. I think probably one of the most important characteristics or traits of collaborative leadership really is around accelerating, breaking down silos by really promoting diversity, bringing people together. And in today's world, I don't mean physically bringing people together. I mean bringing them together metaphorically and through technology and really fostering that innovation and creativity so that we're really leveraging the strengths of our whole team. That has played out tremendously in our state, in our region, in our city. There are so many examples. So I think that really played to, at the state level, Governor DeWine talking about, we're in this together, Ohio. Doesn't matter what our background is, what we look like, where we live, we're in this together, we're gonna show social distance, and we're gonna flatten that curve. He's engaged manufacturing, Battelle, that can now do re-sterilization of N95 masks for healthcare, an industry, an area they never were in, bringing manufacturers together to make us face masks and shields. Here in our own area, the public-private sector partnerships. So the CEOs of our 3 hospitals, Dr. Devaney, Dr. Hart, and Graceful Kulchik, early on started meeting with our county executive and our mayor to talk about how are we going to work together as a city to make sure we're prepared for our patient or for our community. The Greater Akron Chamber has been hugely bringing together different sectors for us. There have been calls put out. There was some early discussion that we could use ultraviolet lights to help re-sterilize masks. And we thought, how are we gonna get ultraviolet lights? So we put out a message through the chamber, and we had businesses in the area reaching out to us saying they could help us. They had the lighting we needed. We put out a call for PPE across all the hospitals, and we had some of our construction companies and builders reaching out and donating their PPE that they had in their stock. We've seen Bounce, our innovation hub, step forward when we were talking about how are we going to take temperatures of everyone who comes into the hospital, with innovators saying, I'm in development on crowd temperature monitoring. We can look at those tools. Or how do we use 3D printing to make the swabs we need to be able to do the testing? We've seen the University of Akron and Neomed and Kent State come together to say, how can we use their physical spaces for either convalescent patients as they're on their way to get better, or that aren't ready to go home yet? Or can we use the support to house our employees who maybe are afraid to go home to their families after they've been exposed? And we've seen donations from all over coming together. So just lots of people looking at what their current operations and businesses are, hearing what the need is, tying it back to that vision and that goal, and trying to figure out how they could help, how they could make a difference. That silo busting, that bringing that diversity together has been huge for us moving forward. Other skills I think we have to pay attention to as a collaborative leader, and probably very important in this time, is making sure that we really are sharpening our soft skills and remembering that everybody in this is a person that is worried about more than just their job, their family, they're a parent, they're a child, they're a grandchild, and really listening and understanding and providing flexibility to the team. And I think we've seen, and I know the hospitals across our area are so thankful to the support that the community is giving the hospital workers by sharing inspiring messages with our team members. We've had lots of food donations from local restaurants to support our team, and just really providing that opportunity to lift each other up and remember that we're all people, and bring a different perspective to this, and supporting each other rather than tearing each other down. Creating psychological safety by empowering our team. You know, I think the first thing we saw everyone do was start to hoard toilet paper. And hoarding is just a way that people are exhibiting something to feel in control about and feel safe around. And, you know, the more we can provide education to folks, it really helps to decrease that fear, and it will really move people to that sharing instinct that we all have. And that's so important for collaboration. So we can do that by really educating folks and making sure that we have hotlines set up and answer frequent questions and do leader rounding with our front lines, and making that fun. So one of the things we did at the hospital was our safety officer, Dr. Michael Bird, brought in a billiard pool cue, which if you really hold it out, it's 6 feet. And we walked around the hospital with this billiard pool cue and talked to people about being 6 feet apart, so that it became a fun way to remind people how to social distance in a positive way, to where lots of people now are walking around telling each other they're not a pool cue stick away from each other. So bringing that fun to that learning, it reduces some of that stress. It brings out that instinct that we want to help each other, remind each other to stay further away from each other so we have good social distancing. And just promoting that you're not in this alone. We have a Northeast Ohio emergency command operation, where while each hospital has its own command system that we're managing the day-to-day in, we're also being represented at the regional level with our hospital CEOs, our county commissioner, our executive, and our mayor, that are planning at that regional level and looking at how can we share resources? How can we make sure we have the right number of ventilators? How can we make sure we have the right number of beds? And working to really move patients across the region so that everybody has the bed they need at the time of need. And then I think the final characteristic that's so important in collaborative leading is flexibility, especially in crisis. Things are changing so rapidly. Scenarios are constantly underway. And when the plus is if you can start in a culture of continuous improvement, you're able to step back and look at all the hiccups that are going to happen, because they're going to happen, as opportunities to learn and reset and move forward, and know that when you're in crisis and you have to move fast, that you can't let perfection get in the way of good. We're going to start with good, and we're going to keep refining through continuous improvement, and we're going to get to where we need to be. And that has never been more evident to hospitals as we look at how the CDC has rapidly changed the standards around PPE and what we should be doing on a day-to-day basis, or how should we be testing folks. And being able to just constantly get that message out and let the folks that you're leading with not become frustrated that the message is changing on a daily basis. Embracing that flexibility and that spirit of continuous improvement, working towards that goal again and that vision, and just reinforcing that over and over again so that people don't lose sight of what we're really trying to get to, knowing that we're going to have those hiccups. So I truly believe that the hospitals in our region, the Akron community at large, really have demonstrated crucial collaborative leadership skills during the past weeks. Our community has really rallied, and we are flattening that curve. We're conserving PPE. Your support for your local hospitals cannot be understated. It is so huge. We feel it. And the spirit of Akron has never really been stronger. I'm just so proud to be part of it. And so my message is just keep it up. We're in this together, and we're going to be stronger for it. Thank you.
Thank you, Lisa. You described beautifully the different traits and qualities that are inherent in collaboration. And you started at the beginning saying, you know, this has been years in the making in our community here. And this is kind of how these years of relationships have been able to come together in a shared purpose for the greater good. I have a question that is related specifically to the traits, and it comes from our audience. And the question is, I'm especially interested in the trait of supporting trust. How have the hospital system supported trust among what is in the past have been a somewhat competitive environment?
You know, I think that that's so true, but really there's been we've really put all the competition to the side, because we go back to what is that common goal. And the common goal for our healthcare institutions has been to serve our community, to be there for our community. There has been and I can say that very honest, no thought about the competition side. We're about, this is a crisis, and I think all of us in healthcare went into healthcare to help people. And there are times where what we're here about in our mission is much more important than who's getting the most patients for which procedures. And this is definitely one of those times. I'm a strong believer in co-opetition in normal times, that you can cooperate. Let's find the common ground. Let's rally around the common ground and work together where we can. And where we can't, we'll compete. And but in a crisis like this, that really just all goes to the wayside, and we really are all working together.
Lisa, if I could tee up a question for you. We're learning through this crisis that the African American and Hispanic communities have been impacted in a much more significant way, and as a result of long-term racial inequities in our society. How do we learn from that in Akron? And how do we use that as a way to propel us to collaborate together to create an equal quality of life for everyone in our community? Any thoughts on that?
Yeah, so this is something that I think we in healthcare and across the hospitals have been talking about before COVID. We've been talking about population health. We've been talking about social determinants of health. And we've known for a long time that food insecurity and housing insecurity, they ultimately affect the health and outcome of people way before COVID. And so I think that what we're seeing in the pandemic is a perfect reflection of what we've known and been talking about. And maybe that message hasn't been heard as loudly as it is now. But I think there have been partnerships. I know at Children's here, we've partnered with the food bank. We've done pop-up food pantries for our patients even before the pandemic. So I think this pandemic is unfortunately shining that bright light on what we've known for a while, but it's really going to propel more folks to come together to galvanize around a new vision about how we can really reduce those inequities.
Thank you.
Thank you.
I was going to say, and Barry, I'm checking the time, and I know that this is a very important question that we like to ask all our folks. So would you want
Sure,
me to
I'm
tee
happy
that
to
up?
tee that up for Lisa. Lisa, something we've asked everyone who's come to speak for us is, what can we do as a community to support you, to support the other leaders, to support our frontline healthcare workers? You know, what's our call to action, and what can we do to thank and support you and so many others who have put Akron in a great place to deal with such a crisis. So thank you.
Well, I think the first thing I would say is continue that collaborative spirit, continue that collaborative leadership. As I said in the beginning, we started in Akron at a foundational place that I think a lot of places and communities would just envy, because we had a lot of that collaboration in place and we could just skyrocket versus having to get that established. And then I think the second thing, for any healthcare provider, we would tell you, stay home. Keep staying home. You're doing the right thing. It's getting harder because we've been here for a long time. It's getting nicer out. We want to know when it's going to end, but stay home, because that's the best thing you can do. Because of what you've done, our hospitals are not overwhelmed this week, which was highly projected. So stay home and continue the words of encouragement. It means so much to our staff to just hear those good wishes. We really appreciate it. It really makes a difference to get people to keep coming through and being there.
Well, thanks, Lisa, for sharing those thoughts with us. You were definitely the right individual to speak about collaborative leadership. We're grateful that you would take time out of your busy day to be with us. And we're just grateful for you. We know Akron is a unique community because we want to work together, and we do come together. And we're especially thankful for Akron Children's Hospital. It's a gem in our community. So send all of our thanks to everyone you work with at Akron Children's. We appreciate you.
I certainly will. Thank you so much.
You're welcome. We're going to conclude our 30-minute session. Just as a reminder for everyone, we'll come back together again next week. We have Lisa King from the Metro Parks and Dan Rice who are going to join us. And they're going to talk to us about the need for renewal and how it helps us create resiliency as leaders. We need to step away, especially in crisis modes like we're in now, just so we can renew, so we can come back and lead effectively. So we hope you'll join us next week for that conversation. And we're gonna move into a breakout session, just share some thoughts on what Lisa shared, any other thoughts on collaborative leadership. And Jeremy, I think I'll hand it back to you to break us up into small groups. Thanks again, Lisa.
Thank you, Lisa. Thank you.